I trained as a radiologist and I really enjoyed the interventional radiology components of my training. And what I discovered was that there was a procedure that was available that had really good science behind it and the medical aids were funded, but that patients weren't aware that they had this option. And the problem in South Africa was that the skills didn't reside with the gynecologists, but rather with the radiologists. So there was a disconnect in that. So my job was to educate gynecologists and patients that there was a procedure that I could do that would be able to treat fibroids without surgery. I trained in Baragwanath Hospital in Johannesburg in Soweto. And at that time, we were doing fibroid embolizations on only a few patients because it was early in the mid-2010s. And those patients did really, really well. These are patients who were very, very sick. They had terrible bleeding. And at that stage, we would only offer it to women who had no other option. Either surgery was too dangerous, they were bleeding terribly, because we didn't know the outcomes of the procedure. We realized they had fantastic outcomes, very low complication rates, and we should expand the indication to the point now that the microsurgery does quite possibly the most fibroid embolizations in the world in a year as an individual practice. I was at a congress where we were discussing all sorts of interventional radiology techniques, and there was a presentation about fallopian recanalization. And I was surprised to learn that I'd never done it, never learned about it. It just wasn't part of our training in South Africa, but it didn't make any sense why we couldn't do it. So I went up and learned about the technique and was instructed on how to do it and realized, well, this is something that's well within our possibilities, and there's a large number of patients who suffer from infertility due to blocked tubes. I feel a little selfish having done this procedure because I get such reward from it. So firstly, I just doing a successful procedure, you feel great. And then the patient calls you a few weeks later and says they're feeling fantastic, they've had an amazing period. Then years later, they may have a baby and you get another reward. So the truth is, there's a huge amount of personal reward in this. The patients' lives are being changed, and we would like to expand that possibility for patients. After having performed so many procedures on so many patients, we've seen the long-lasting effects of the procedure, and that patients have told so many people that they know about it. I'm seeing sisters and daughters of patients coming through, so it's very rewarding. So the microsurgery was an opportunity for me to be able to do interventional radiology independently of a large practice that would be doing imaging. So I've always found that there was a conflict between the imaging side and the interventional side, or diagnostic side and the interventional. So when I was relieved of the pressure stress of partners wanting me to report scans, I was able to do more procedures. And it also means that I can do procedures that I want to do. So after doing so many fibroid embolizations, we could then move on to fallopian tubes and cancer treatments and pain treatments. So there's a wide range of interventional radiology procedures that we perform because we're able to focus on the specific niche of our skill set. Many patients come to me because they've been advised to have a hysterectomy, a removal of the uterus, because their symptoms are so great. They may or may not have had children by that stage, and it's a very, very daunting process. They don't want to remove the uterus unnecessarily. And the long-term benefit of having a uterus is also quite clear. Obviously, if it needs to be removed, sure. But if we don't need to remove it, if we can do a procedure that gives the same benefit, but still maintain the uterus, and integrity of the pelvis, makes absolute sense. So I'm telling patients that we would like to offer them a procedure. Obviously, we select the right patients, and if they need other treatments, we would tell them they're going to be assessed by an independent authority. But that there is an option out there. They can have babies. It's very safe, and they'll be very happy with the results.